Health workers say that for the best pregnancy outcomes, women and their partners should work to improve their physical, emotional and medical well-being before trying to conceive. According to the World Health Organization, preconception care is the provision of biomedical and social health interventions, among others, to women and couples before the conception occurs. It aims to improve health status and reduce behaviors and individual and environmental factors that could contribute to poor maternal and child health outcomes. Dr. Castro Chisule, an obstetrician and gynecologist, says preconception care helps assess health indicators like weight, height, body mass index, and it screens for conditions like diabetes and hypertension, which can lead to pregnancy complications if not addressed early.
Weight is important because people who are at extremes of BMI, either very low BMI or very high BMI, are at risk of certain adverse outcomes or problems within pregnancy. You may make a baby who is abnormal because of your weight. You may be at risk of having a miscarriage. You may be at risk of having preeclampsia, which is high blood pressure in pregnancy.
Dr. Chisule advises that mothers planning to conceive to stop habits such as smoking and alcohol intake at least 3 months before trying to have a baby.
Because alcohol and smoking not only affect our eggs, it also affects our sperm. It affects the quality of baby that you've made. And even when you make a baby, it continues to be toxic to the developing baby.
Another essential part of preconception care is folic acid. Dr. Joseph Nsenga, also an obstetrician and gynecologist, explains that folic acid, which is vitamin B9, is crucial for the proper development of the baby's spinal cord, brain and nerves. And when a woman misses folic acid, there is a higher risk of the baby developing abnormalities.
For a baby to be formed, especially vital organs, they depend on DNA. So folic acid contributes a big part for DNA formation, or what we call DNA synthesis in these babies. So a deficiency of which may result to babies being born without a developed brain, defects on the spinal cord, and also other problems. Babies will be born with a condition called spina bifida, where there's a defect on the spinal cord. Others get hydrocephalus, and then others get issues, nervous problems. They have issues with their nerves, they can't control urine, they have weak limbs. So all those things stem from a deficiency of folic acid.
Even if a woman discovers she is pregnant later, she should begin taking folic acid immediately under the guidance of a health worker.
Folic acid, especially taken before conception and during the first 3 months of conception, that's where organs are being formed. We call it organogenesis. That's when folic acid is crucial. I think you've seen babies born with abnormalities, and if you ask those mothers, most times these mothers missed out on swallowing folic acid in the first 3 months.
While folic acid is present in green vegetables and citrus fruits, among others, supplements are often needed to meet the recommended intake. Dr. Nsenga adds that women over 35 and those who frequently take antacids for ulcers may have difficulty absorbing folic acid, putting them at a higher risk of deficiency.
We need to supplement because what we get in food is never enough. You need 1,000 micrograms of folic acid on a daily basis. You can't get that one in food, so you need to always get a supplement that is, maybe if you have food that is fortified with folic acid. Other than that, everyone should take a tablet of folic acid every day.
Another part of preconception care is screening for sickle cell disease, a common inherited blood disorder leading to a shortened red blood cell lifespan, chronic pain and life-threatening infections. Couples are encouraged to get tested so they can make informed decisions.
So people get to know this very late. They never test, and they only get to know after the child is 6 months that you know what, this child is a potential sickler. So our duty as your doctors is to give you information, as much information as you can get, to say you are a carrier and your partner is a carrier. So because you're both carriers, there's a risk of you getting a child with sickle cell. So that person who is a carrier also are called people with a sickle cell trait. When you have a trait, when you're a carrier, you live a normal life. And that's why the sickle cell has persisted for a long time, because people who are carriers never get to know that they have a sickle cell trait in them. So they live normal life. So it's important for people to test to know that I may be a carrier. If I'm a carrier, I need to look for a person who's not a carrier.
But with advancements in technology, there are now new ways to prevent this genetic disorder, but there is need for the couple to do screening before conceiving.
And for those who have more resources, there are things we can do before you conceive for us to engineer a baby who's not a sickler. So we usually do IVF plus pre-implantation genetic testing to confirm and see if the potential babies you're likely to carry are going to be sicklers or not.
Blood group compatibility is also important, especially in cases where the woman is rhesus negative and the partner is rhesus positive. In such cases, the mother's immune system can develop antibodies that attack the babies, potentially leading to complications. When a rhesus positive baby is in a rhesus negative mother, the mother's body sees the baby as foreign and fights it.
So therefore it's important to know, one, if my blood group is usual or if it's one of those that can affect the developing baby. And then we as your doctors will tailor treatment or management for you for your pregnancy to avoid that risk. If you're rhesus negative and your partner is rhesus positive, that's the exact couple that will benefit from our treatment.
Mental health, often overlooked, is just as important as physical health, and health workers say it should not be ignored. The doctors add that one should inform healthcare workers of their medical history and any medications one is taking, as some may need to be reviewed or adjusted before conception.
It could be a skin disorder, it could be chronic disease, it could be high blood pressure, it could be diabetes, it could be any other ailment. It's important for us to know, as they prepare for pregnancy, are the drugs they are taking appropriate for this period or not?
Other important tests, including HIV screening, should be conducted. Nobat Atkunda, NTV News.